Hi, I'm John Clark. I'm a postural alignment specialist certified by the Ecise Institute to teach postural therapy. Today, we're going to be talking about an Ecise called static back knee pillow squeezes. This is a variation on the Ecise sitting knee pillow squeezes. If you want to find a video about that exercise, you can check out the card right here. So let's talk instructions for the static back knee pillow squeezes exercise, or Ecise. Now, just like in the standard or the sitting knee pillow squeezes, which you can see if you're interested in that Ecise in the video above in the cards, you can use various objects for this. You can use a couch cushion, you can use a thick yoga block, you can use a thinner yoga block, you can use even balls, things like that, like squishy, bouncy balls. I prefer the thicker yoga blocks like this. Now, when you're getting into position, you're going to need a bench or an ottoman or a chair or a block, something along the lines that allows you to get your knees directly over your hips, and it's very important, your knees at 90 degrees of flexion. I don't want it too high so that your knees are in less flexion. I also don't want it too low such that your knees are bending to more than 90 degrees. As you can see, I have an exercise bench here, and then I use this towel that I can fold up to achieve this kind of rug, whatever you want to call it, that I can fold up to achieve the exact right height where my knees are at 90 degrees. Now, just like in the sitting knee pillow squeezes, I'm going to place that block between my legs, between my knees, and I'm going to squeeze and release slowly. This is 1 second to squeeze, 1 second to release. I'm not trying to murder the block. This is only 25 to 50% of my maximum strength. Well, why is that? Well, here's a difference between the sitting knee pillow squeezes and the static back knee pillow squeezes. When I'm doing these pillow squeezes here, I want my lower back to stay completely flat on the ground. In the sitting knee pillow squeezes, we were trying to maintain that arch in the lower back because we were sitting upright. Here we're trying to achieve something slightly different. And if I start to squeeze too hard, what you're going to see in most cases is when I get to like more than 50%, most people are going to start arching that back. And what is that doing? That's allowing our hip flexors to compensate for our hip adductors. In this position, when the hips we're trying to let the hip flexors relax completely, essentially, and take them out of the job of doing femur rotation, which is the largest postural deviation fixed by this Ecise. We're trying to bring the femurs to a even position, even if they're not pointing straight ahead at the end. We're trying to reduce disparities between the two. So if one's pointed further out than the other, we're trying to get them to be pointing out to the same direction. And if we are, if we're letting that lower back come off the ground because we're squeezing too hard, all of a sudden the adductors are no longer doing the work. Our hip flexors are doing the work. Our lower back is doing the work. We have to eliminate those compensations. So we are squeezing 1 second on, 1 second off. 1 second on, 1 second off. I'm not doing jerky pushes in. I'm not doing jerky releases. I am doing slow, controlled, steady motion. I'm not pausing at the maximum squeeze. I'm not pausing at the release. I'm keeping it in steady motion. Each repetition takes about 20 seconds. Typically, you'll see repetitions of 3 sets of 20 repetitions for this Ecise. If you can't do that many when you're starting out, don't worry about it. Start at a lower number, work up to it.